The results that have come back from our case yesterday tell us two things. First, that we are dealing with the Delta variant. The second thing it tells us is that it has linked the current genome sequencing of cases in the New South Wales outbreak. Our case has originated in Australia.
Further to the 5 cases reported earlier today, there are now a further 2 cases of Covid-19 to report in the community, our total now being 7 cases, all of whom are in the process of being transferred safely to the Auckland quarantine facility under strict infection prevention control procedures. Our first case, we will call Case A, that was announced yesterday. The other 4 cases announced earlier today include a work colleague of our original case, that's a 20-year-old male. There are 3 flatmates of that case, a 21-year-old female who is a fully vaccinated health professional that works at Auckland City Hospital and has been working in recent days. And as you'll be aware, there are measures underway to respond to that. There is a 25-year-old female teacher from an Auckland high school, that is Avondale College, and that college has been contacted, and the community will be receiving specific information about what to do to follow up testing and isolation, of course, for anyone who may have been in contact with that person. And the other flatmate is a 29-year-old male. There are 2 further cases that I'm just announcing, a 21-year-old female and a 19-year-old male, both of whom live in Auckland, and both who are linked to the current cases as friends, and who have spent time with one or other of those other cases. So in total, we have these 7 cases that are all linked.
So far, as you will have heard from Dr. Bloomfield, our contact tracers are reporting that when they are calling people who have been exposed, they are at home. I need everyone to think about what it would be like to receive that call. If you do, we need you to be at home, not out putting others at risk. We very unfortunately need only to look at New South Wales, who today have reported 633 cases. 92 were active in the community while infected. Level 4 restrictions are there to protect everyone and to make this lockdown as short as possible. Let me come then to decisions that are being made to provide extra protection for those who are working during Level 4. From 11:50 p.m. tonight, it will be mandatory for everyone aged 12 and over to wear a mask when they are visiting any of the essential services that are currently open, including supermarkets, pharmacies and service stations. Will also be a requirement for staff who work in those places to wear a mask also. This is about ensuring those workers are protected and ensuring those who visit them are too. As you'll know, it's already a requirement to wear a mask on public transport and planes, and that will now include places like bus terminals and also taxis. Simply put, at Level 4, if you're in a place that is allowed to be open to provide services to people or transport, you must wear a mask. One of the questions I've been asked in recent times is, do vaccines make a difference? The answer is yes, an enormous one. To put it bluntly, if you've had the vaccine, you are less likely to catch COVID-19 and much less likely to get sick or die if you do. In fact, the risk of infection, according to the CDC, is reduced 3-fold in vaccinated people. But a few people do still get infected. We call those breakthrough infections. And people with breakthrough infections can transmit the virus. That's why we do still ask everyone to be cautious, no matter what your vaccine status is. But if we turn pretty good into great, that will end this outbreak more quickly. I know Delta is making people feel anxious and more afraid. And it is true that we will see more cases. But we can get on top of this, just like we have every other time, if we do it together.